Hi guys, welcome to Tutor IMG's short medical series. So in this lecture, we're going to be taking a look at some other overlapping conditions in psychiatry: body dysmorphic disorder, illness anxiety disorder, and eating disorder. Now, the reason why they might seem overlapping at times is because all three of these conditions are actually concerned with the appearance of the body, right? So they are all concerned with a body appearance issue. In illness anxiety disorder, the issue with body appearance, or rather misperception of the body, is mainly due to a perception of a disease process. Now, illness anxiety disorder falls under the somatic symptom disorder category now in DSM-5, and as such, the component of symptoms or somatic symptoms in illness anxiety disorder is much milder, right? So the condition that the patient feels that they are laboring under is actually a much milder condition, and it might actually not even be present at all. And the patient might just be obsessed with the idea of being sick, right? So what are we looking for? We're looking for an obsession about the body, but the obsession seems to be with the idea of being sick with minimal symptoms. On the other hand, when we talk about body dysmorphic disorder, here what's happening is that the patient is extremely, again, obsessed with the body, but more so about its appearance, the physical appearance. And when we talk about physical appearance, we will notice that the question on the boards will mention specifically the face, head, neck area, right? All the parts that are exposed. These patients are going to be very obsessed about how the world looks at them, and they are constantly worried that people are looking at their imperfections, that they are so usually you'll actually feel that they're laboring under delusions of reference, right? Delusions of reference. What is basically that they feel that they are being talked about and their defect is being laughed at, and wherever they go, they will then be preoccupied with actions, right, that are meant to disguise their flaw. So what do we mean by these repetitive actions or repetitive behaviors? Now, I know that starts to sound a little like OCD, but the repetitive actions in this case tend to be things that are very specific to appearance. For example, mirror checking, right? Even so much so that they'll be looking at the back of silver spoons to look at their appearance. Skin picking. When they're standing in front of the mirror, they just cannot resist picking at their skin. Excessive time spent on grooming. Excessive money spent on purchasing makeup to camouflage their imperfections, right? Almost changing their clothes 4 times a day. Now, the other psychiatric condition that's obsessed with body appearance is eating disorder. In eating disorders, we have some very overlapping features with body dysmorphic disorder, where patients might have excessive exercise, right? Excessive dieting. But where in eating disorder, you will see a preoccupation with weight and not so much a preoccupation with physical, or rather face and head and neck area. There isn't a preoccupation with these specific features, right? So in eating disorder, the focus is mainly on weight loss, and you will find a lot of obsession with purging and binge eating. So the focus will be on food, vomiting, and weighing. Not so much with face, head, and neck appearances, and all of these other things that I've mentioned here. Out of these three, body dysmorphic disorder unfortunately has a pretty bad outlook, because insight is very, very poor in body dysmorphic disorder, almost as bad as anorexia patients in eating disorders. But where in eating disorders, insight can at best times be fluctuant, in body dysmorphic disorder, insight is usually very poor. These patients are often associated with substance abuse, with depression, with suicidal behavior, and even self-inflicted surgeries aimed at fixing the unsightly appearance. Illness anxiety disorder, out of the three of them, seems to have the best level of insight. So based on this, I hope you're able to better differentiate these three on the boards. And for more such videos, please subscribe to our channel and keep supporting us. Thank you so much.